Hi, I'm Annie, and I'm on the staff at NAMI Delaware. Thank you for joining us today for a conversation about SEL and its positive impact on youth mental health. Before we begin, I'd like to tell you a little bit about our agency in case this is your first time hearing from NAMI Delaware. We are part of a national organization which is called National Alliance on Mental Illness, NAMI.org. NAMI is the nation's largest grassroots mental health organization. And if you're tuning in today from outside of the state of Delaware, you can find your local NAMI by visiting that website. NAMI Delaware has been in operation for about 37 years now. We offer support, education, advocacy, and housing in the first state. Since March, we've been providing our programming and support groups virtually, and there are a variety of offerings to choose from. We have support groups for peers. We have support groups for family members. We have education programs, a variety. And we also offer private trainings customized to suit the audience. So if you'd like to learn more, you can visit our website at namidelaware.org. And there you can also learn about our housing program and you can access the housing application. We do have a couple of events we wanted to make you aware of. Next Thursday, we offer our peer support group called NAMI Connection. It will be Thursday evening at 6:30, and we ask that you register online so that we can send you a private link via Zoom. So you can learn about that on our website as well. We have a program this Thursday that will become a recurring monthly event called Sharing Hope Community Conversations. And each month it will feature different guest speakers with our volunteer moderator, Nimade Bewu. Nimade will be talking this Thursday about implicit bias, and she has two guest speakers that she'll be having into the call. So if you'd like to learn more about that conversation, again, check out our website and you can find that link. Next week's Facebook Live conversation will be about the power of stories. And if you've missed any of our Facebook Lives and you're wondering what else we do during our Facebook Lives, you can actually look at all of them. If you visit our website and look at virtual programs, if you scroll down, you'll see a link that will take you to all our Facebook Live conversations. So, one more thing before we invite our guest, and that is just to remind you that you are not alone. We are here with you and we support you. So if you need any crisis support in the event that while we talk today, it generates some strong feelings, we want to make sure that you feel supported and you know where to turn. So there are a couple of options we'd like to share with you. The first one is the National Crisis Text Line. If you text 741-741, you can get connected. And the other is a resource located here in the state of Delaware. It's Delaware's Hope Line. You can call or you can text and get connected to resources in our state. And those resources include the crisis response resources in Delaware. So we are welcoming you now to have a conversation with LaWanda from Capital School District to talk about social and emotional learning. Welcome, LaWanda.
Thank
Hi.
you. Hi.
I'm glad to see you. We had a few technical difficulties at the beginning today, but everyone who's been tuning into Facebook Live or anything online knows how challenging these things are. And none of us, or most of us, have no experience in television production, which just seems like what we're doing now. But we're glad to have you. Before we even talk about SEL and that important conversation, I just want to tell everybody how you and I met. So my background prior to joining NAMI Delaware was as a teacher. And I think you and I met about 3 years ago at an education conference. Is that about right? Yeah?
That is absolutely right. Yes, you actually went to a breakout session with a fellow educator of mine, and she recommended that we meet because we had some shared characteristics as parents with lived experience, and that we had a similar passion for doing the right thing to meet the needs of all children.
Absolutely. And together we actually embarked on several neat projects, including bringing youth mental health first aid more broadly to our state, which is very exciting. I know you're an instructor now of youth mental
Mhm.
health first aid, which is not technically a NAMI program, but it's something that NAMI Delaware supports. And you're also an instructor of NAMI Basics, which
Mhm.
is for lived experience, for people with lived experience as parents or caregivers of children with mental health challenges. And then you're also a presenter of Ending the Silence, which is for youth. It's also for school personnel, and it's also for parents. So we're so grateful for all that you do for NAMI Delaware, and certainly for all that you're doing for Delaware communities statewide. So let's talk about SEL. So your role is, well, you're student services supervisor at Capital School District, but you're also co-facilitator of Delaware SEL Collaborative. So let's talk a little bit about that.
Great. Yeah. And it's wonderful to be here today and parallel passion that I have. So, the Delaware SEL Collaborative has been in place for about the same time that you and I have been
Mhm.
have known each other. So we're really at about 2.5 or 3 years now, and it was a grassroots effort to put a focus on and some common language around social and emotional learning across the state. We're a small state, and there's a lot of power in that we don't have to drive 2 hours or 4 hours to get to the State Department of Education. In Capital, they're literally in our backyard. Um, and there's some commonalities that we should have and some shared language we should have across the state when we're looking at things like social emotional learning.
Right, right. So it became the conversation because we need to have kind of a shared language and a shared interest. And why is it important for parents, even as well as educators, to even understand this?
Right. So let's talk about what social emotional learning is to start
Yeah.
with, because it's had a lot of different names over the years, but it's phase five basic competencies. Delaware is a participant in CASEL, which is the Collaborative for Academic Social Emotional Learning, our CSI, or Collaborating States Initiative. So we take their definition. It's the process through which children and adults, all humans, acquire and effectively apply knowledge, attitudes, and skills necessary to manage your emotions, set and achieve positive goals, feel empathy for others, understand where other people are from, develop positive relationships. So we talk often about the wheel, Castle's wheel, which is there are 5 competency areas: self awareness, self management, social awareness, relationship skills, and then responsible decision making. And we really consider these the foundational building blocks on which all other learning happens. So it's really important that we have a common understanding of what is self awareness, and then what is appropriate level of self awareness at different ages. Obviously, the self awareness, of a 2-year-old is going to be different than that of a 12-year-old or even of a 24-year-old. So having a common understanding of not only what are these competencies and what are their definitions, but what are those discrete skills that we want specifically in K-12 education our students to have so that they can progress and move forward.
Great, great. So back in the day when I was a
Mhm.
teacher, I remember, and this was dating me, I know, but we talked about character education. Remember that?
Mhm.
Like 80s and 90s, and yes, I'm 100 years old. So in the 80s and 90s, we were learning about, and as educators, we were learning about the impact that understanding good character traits and utilizing them would have on our students. But then I think toward the end of my career as a teacher, toward the last maybe 5 years or even 10 years maybe, there was such an emphasis on scholastic achievement,
Mhm.
especially around testing, that it felt like the character piece drifted away. Am I remembering that correctly?
Right. So I have similar memories of that. I know when I was in school, we had character education, we had conflict resolution, we had,
Right.
peer mediators, and we really focused on a lot of those skills. Of course, as a student, you don't really recognize that it was part of the whole package. But then political pressures and other things that came along, we really shifted towards a focus on standardized tests, things we could discreetly measure and say schools were achieving, students were achieving, or they weren't. What we've found is a couple of important things here. One, when we don't take care of those basic social emotional skills, the other academic learning, is impacted. But two, now that we've shifted back towards looking at social emotional learning, and it's not just the job of the counselor and it's not just the job of the classroom teacher, but it's every adult focusing on healthy social emotional development of children and youth, is there are studies that prove when we explicitly teach social emotional skills. So I'm not going to sell a specific program, and the collaborative is not going to sign off on a specific program, but we're going to focus on skills because they can be taught and developed in a multitude of ways. They have better social emotional skills. That's not a surprise. Improved attitudes about themselves and others. Classroom climate is improved. Conduct behaviors decrease. There's actually less emotional stress and decrease in drug use.
Wow.
And here's the big one. For every $1 we spend on social emotional learning, we have an $11 gain in social outcomes. So again, going back to decreased substance abuse, decreased youth delinquency, and when we explicitly teach social emotional skills, there's also an 11 percentile gain in academic skills.
So it literally pays off.
It literally pays off.
And we can prove this.
Yeah,
that's amazing.
Absolutely.
That is amazing. So clearly it's worth the time and effort that the Delaware Collaborative as SEL Collaborative is spending, and also nationally. And then it's probably worth time for parents to explore ways that they can become connected to this information too, I would guess. Now, through the lens of NAMI Delaware and what we do, we're concerned about the mental health of our young people. And certainly when it comes to what we know of research around mental illness, 50% of mental illnesses begin by the age of 14. And we know that 1 in 5 people lives with the condition. So we're talking about a large number of people that are impacted young. So by the age of 14. So is SEL, does that connect? Is there a connection there?
So I'm going to go back to the idea of foundational skills.
Okay.
So the stronger our youth are as a group, the more aware we are as adults of what those skills are, the easier it is for us to, one, recognize if there is a student who has a challenge that's going on. So if we are aware, and if students are aware, right? That's the purpose of a program like Ending the Silence. There's a lot of power in that peer recognition.
The peer awareness,
I have, a friend who needs help. And part of the social emotional skills is built around advocacy, not only advocating for yourself, but then advocating for those who are your peers. So it is the foundational layer, but then it's also just a protective factor. When we think about the positive influence of knowing who you are, knowing how to ask for help when you need help, and being able to deal with yourself with a little bit of grace. There's no, one of the great things I love about looking at social emotional learning is it gives us a chance to really look through a strength-based lens, not this is a bad kid, because
finding
that label
flaws
helps no one. Or finding flaws, to say, you are really good at recognizing your own frustration level. That's great. Now let's help. What options do you have that are productive? When you are frustrated. So it's about advocacy. It's about empowering students, not saying, oh, you shouldn't feel that way, which is something that we run into in mental health, right? Often the stigma
Definitely.
comes around, well, you shouldn't be sad, everything's fine in your life. It's not nearly that simple.
Exactly.
And allowing students to say, it's okay that you feel sad. Let's dig
Right.
into why and what can we do. It's
Right,
about
that
protective
empathy
factors.
piece. Yeah, protective factors for sure. So I'm getting a lot of pop-ups here on comments, which is terrific. That means people are tuning in. So we have some people just saying thank you and um, wow, great job, those kinds of comments. And then we had a question. I'm not sure how deeply we can go into this right now, but I definitely want to acknowledge that Kelly is asking a really solid question here. And I think I know Kelly. Um, so she says, what do you think is stopping educators from integrating into Delaware schools? So really going down the lane of how are we going to make SEL common across the state? And it sounds like that's what you're working on.
Right. So I do want to give a disclaimer here. The Delaware SEL
Good.
Collaborative is grassroots. Now we
Yes.
are acting under the approval of, and honestly, Secretary of Education Bunting has been a fabulous supporter of this work, but she
Hmm.
wants us to be very cautious. We are not talking about standards. We're not talking about accountability measures. We're talking about doing what is right for kids because as educators,
Hmm.
this is our passion
Right.
and we know it matters.
Right.
So you'll hear when I talk about the competencies, I use a couple of different words. I say competencies and I say guidelines.
Okay.
What I think has held educators back, and to give credit here too, there are educators who are already doing
Yeah.
immense work in social emotional learning.
Hmm.
There are schools that have entire social emotional curriculums and programs. The challenge is we're doing it in isolation. So we haven't had a
Right.
shared language.
Right. Silos.
And yes, and we're
Hmm.
great for that in education.
Yes, we are. We're good at it.
And we haven't had a shared understanding of the value
Yeah.
in order to prioritize it. Because the last thing anyone in education wants this to be is one more initiative
Yes.
that sort of becomes a binder that dies on a shelf somewhere. This
I,
has to
I
be,
love that. Wait, I have to think about that for a second because I've had a lot of those binders over my years. The binder that sits on the shelf and keeps getting pushed along
Mhm.
and along and ends up in a box at the end of some June, right?
Right, right.
Yeah.
I still have some, I think, at home that I moved out of my classroom and I don't have room for them in the district office. It, we envision the collaborative as an ongoing group that continues to support this work. Establishing a common language is just the first. Now,
Right.
along with not being standards based, though, that means we can't force people to do this. But
Okay.
the truth is, we know most schools are already doing some piece or part of it.
Right.
And I have not had a conversation with anyone yet who said, oh, yeah, we don't want to do that.
This is a terrible idea, right?
This is a terrible
Right,
idea.
right, right. Well, I
Um,
mean, you have to figure you and I have a similar path as far as our number of years in the classroom. We were doing these things before we had names for what we were doing. Am I
yeah.
right? I mean,
Mhm.
so now we're really, like you said, providing a common language and constructing something that we can all refer to and talk about together. But we're doing so much of it. I'm not in the
Mhm.
classroom anymore. I still speak as though I am, but I think so many educators and so many schools, like you said, are doing bits and pieces. So now this is just sort of bringing it together. And I love the grassroots image because that's what NAMI Delaware is too. And NAMI as a national organization, grassroots. So that's where we get the work done. That passion. All right.
It
So
is.
so can we move into kind of what's going on now and how SEL may help? I mean, we've experienced a global pandemic. And if that's not enough, now we have a national call to action, which we welcome, certainly. And you and I spoke about this before. Um, it's a very turbulent time. It's hard to be settled with. Oftentimes we turn on the news and we just feel distraught, right?
Mhm.
But it's welcome in the sense that actions are being taken and positive things are happening, right? So around racial justice. So
Mhm.
how can SEL perhaps help young people cope with what's going on and perhaps educators and parents?
Right. So I think it's interesting that this is really an intersection between uh, SEL, mental health, behavior sciences,
Mhm.
growth mindset. What we
Yes.
know today is so powerful. No one person stops learning or stops growing or stops trying to become a better person, we hope.
We
Um,
hope.
and and so, but we know that, those who do, there are barriers to change. As
Sure.
humans, we don't like change. It
Sure.
unsettles
Sure.
us. So
Sure.
this is a great opportunity for us to look for ways of how do we use SEL as a lever for equity and for racial justice.
Oh,
Um,
can you say that again? I think that's like a sound bite we need to play back.
sure. So it's how do we use SEL as a lever for equity and social justice?
Yes.
I heard someone say something that I took from another webinar, which is transformative SEL. So there's kind of a new layer of SEL, which
Okay.
is transformative SEL, takes us out of the theoretical and into the practical.
Okay.
So thinking about development, it's a lot easier for me to talk to my 13-year-old about implicit bias
Hmm.
and the fact that she may judge people in an instant and put them in a category, because this is where it goes to behavioral science, right? That's what we do as humans. We categorize people and we categorize everything and
Right.
respond,
Hmm.
because that's the way our brains work.
Right.
So we respond accordingly. Well, it's a lot easier to have that conversation with the 13-year-old than it is, say, with my 85-year-old father, who has habits that have been built in and ingrained year after year after year. Um, but it's still possible to have the conversation. And that's where being self aware of myself, my own biases,
Hmm.
um, and also socially aware of different people and where are they on this journey to equity and to, being social justice champions. You have to be very sensitive to that
Sure.
and aware that not everyone is at the same place, and
Right.
then you can engage in the conversation wherever they are.
Sure. Sure,
um,
that's powerful. It's funny that we're talking about this at the very same time. I know that you don't have access to see the live comments, but Kelly Green just said we need to infuse SEL throughout the community. But
yes.
really, that's kind of where you're going. You're saying that we can have these conversations in schools with students, but
Hmm.
we can also have them with the 85-year-old fathers in our
Hmm.
lives, right? Or the anywhere in between.
Right. And I also think it's interesting, so I'll pull it back to mental health,
Sure, sure.
that the stigma that you see around some of the equity issues and some of the social justice issues is similar to some stigma that we see in mental health.
Hmm.
Different generations deal with things differently. And I know just across the community, when my child first started having some symptoms of her mental
Hmm.
illness, the judgment and the idea, well, she should just be able to fix that. She should
Hmm.
just be able to pull herself up by her bootstraps and get
Right.
over it,
Right. Suck it
is
up and
some
play through.
right, suck it up and play through, is
Right.
some of the same things we hear, now around issues of social justice.
Hmm.
And so understanding where stigma comes from
Hmm.
within the self and how we work as a community to get beyond that is so important. And that goes really to relationship skills in SEL. Um,
Yeah.
it's not enough to just be right. You have to listen to others,
Right.
try to understand their viewpoint, and then work together towards a common understanding.
Yeah. So powerful. So critical. And it's very exciting to see the directions we're going. So let's talk about the work. The Delaware SEL Collaborative. You're drafting these competencies, if that's the right
Hmm.
term. I think you
Yep.
used guidelines too. I think you said.
Hmm.
Um, without revealing anything, because I know you have a draft coming out soon. So drum roll and all of that. But can you give us some ideas of what people could expect to see and how they might access those things?
Sure, absolutely. So they actually are already released. I'm going to
Okay.
share towards the end. There is a bit.ly link that people can use to go in, look at
Oh,
them, and even provide live feedback. because we are in the process of revising now. And on July 22nd, we're going to have our summer convening, which is available on Eventbrite for the general public, and actually PDMS if you're a school employee.
So that's July 22nd. I'll bet Wesley can share that
July
on
22nd,
the comments.
yep, at 9 a.m. And we're going to do it virtually. And we're going to go over the recommended change. So we have some recommended changes that are out there on the draft that is currently existing. We'll have some updates to that. We will re-release in July.
Okay.
And also going to do something, again, I don't want to reveal too much, but we're actually going to have the American Psychological Association doing a little presentation. Again, it's just about the intersection, how this crosses over. This is not at all a standalone silo.
Sure.
We're going to do that. And then we're going to, our next step after we have the draft of the guidelines is really to start creating a toolkit. How do educators implement this in their schools? How do districts look at funding for SEL in their budgets? You know, how do we talk to parents, and then helping parents? There's already a wealth of material out there. I have to give credit to CASEL, again, the national organization, with their Collaborating States initiative. They already have states who have created all of these resource kits. There are webinars, there are worksheets, there's just a plethora of information that's already out there. And we just want to pull that together in one centralized location for Delaware, and make sure that we're giving as much resource and technical assistance as possible for people who really want to drive the work forward.
That's great. And I have to give credit where credit is due. And Wesley came through as we're chatting. He's just popped in the comments the link, the Eventbrite link for everybody. So there it is. If you're interested in joining this webinar July 22nd, access the link there and sign up. So that's terrific. So what about some examples? Can you, I know you had talked about before that the document you're creating is going to provide some age groups. And I realize that age groups are kind of, that's flexible because it's not as though someone reaches this age and suddenly they have this immense skill or something. It's a developmental thing, but giving us some ideas of maybe what we could look for, what we might learn on this, in this document.
Right. So, as an example, in the K2 grade band, so I'll just talk through the grade bands. We actually already have early learning standards in Delaware, which cover our pre-K students around the area of social emotional learning and some other, you know, discrete skills. But so we start at kindergarten, we go K2, then we do 3-5, 6-8, 9-12, and adult, because it's really important that we don't forget that we do have expectations as adults. And to your point, Annie, it's really that continuum, right? So on the K2 competency, as an example, in self-awareness, the benchmark would be to demonstrate an awareness of one's own emotions. And at the K2 level, that then becomes accurately recognizing and naming basic emotions. So I'm happy, I'm sad, I'm mad, I'm afraid, I'm hurt. Communicating those basic emotions. Again, I feel sad.
And then so recognizing them in themselves, but then sharing is a separate skill. Okay, got it.
And then the third skill in that, for that grade band, would be describing emotions and the situations that cause them. So saying, I am sad because Johnny just took my doll away. Now, that's very basic, but we want to keep this very basic because, to your point, it's a developmental, it's a range.
Right.
And we know that different students are going to be at different places as they go through. And let's be honest, any of us who have ever had children of our own or have interacted with children in school settings, their skill in any particular area might differ by the day. And also, quite frankly, even as an adult,
I was just going to say, and whether or not I've had coffee or
right. Whether or not I've been able to get a nap, you know.
That's right. I've had my sleep for the day. For the night.
So then that same competency, right, demonstrating awareness of one's own emotions, just as a comparison, the 9-12 grade band becomes much more complex. So identifies personal emotions as valid, regardless of how others expect them to feel. This is where you really see the
Mm.
empowerment.
Sure,
It's okay for
sure.
me to feel sad.
Yeah. And
Um,
even if someone around me is judging me for it, I'm okay because I know it's okay that I
yes,
feel that way.
exactly.
That's
Um,
awesome.
being able to describe the external event or thought that triggered the emotion. We have a lot of references in here to sort of that feeling, thought, behavior chain.
Uh-huh.
Because if a student doesn't understand why they do what they do, we can't help them get to adjusting it.
Right.
Recognizing how positive and negative expressions of emotions affect others. Again, I have a very expressive face. I've had a real challenge in this new Zoom webinar world
Yeah.
of trying to not focus on how expressive my own face is. But it's important. It's
I do the
important
same thing. I
that
do the same thing.
students, that
Sure.
we empower them to recognize your potentially even microaggressions.
Mhm.
Uh, Other people judge. That
Mhm.
eye roll has an impact on someone, even if you didn't
Sure.
mean to do it.
Sure.
Uh, and then, acknowledging the appropriate time and place to safely process emotions. This is where the
Okay.
tie to mental health you can see gets
Mhm.
even stronger.
Yes, of course.
And then understands the effect of self talk on emotions.
Yeah, I noticed that and really wanted to jump in on that because that self-talk piece is such an important element to the concept of treatment. And when one is in treatment, they may be learning these skills about listening and self-talk to help
Mhm.
support a positive outcome. So it
And
sounds
so,
like that alignment is there already.
so how fabulous would it
Mhm.
be if we had these things being explicitly taught, starting
Yep.
earlier than ninth grade, obviously, but so that students had a general access to that skill,
Right.
and could not only use it themselves, but they could help peers
Sure.
process things. It's incredibly
Yeah.
powerful, and I'm very excited to see where we go next.
Yes, absolutely. You mentioned we do have a question, and you mentioned that Secretary Bunting has been incredibly supportive of this effort. And the question is, how about DSEA? Is DSEA supporting this effort as well?
So we are waiting until we have the second round, the second draft, to get official endorsements. But
Okay.
yes, so we
Okay.
have the Delaware School Counselor Association as part of our work. DSEA members have been part of the work and the conversation. We were going to present at Policy and Practice for the Delaware Academy of School Leadership. However, that's been put off till August, but we're still going to have
hmm
a presentation of the competencies at that point and really dig into implementation and how to do that work, because that's the weight that
hmm
administrators carry, is how do I make this work within
Right.
a school that already has all of these other demands and needs.
Right.
Um,
Right.
but it's
They.
also
Yeah. Go ahead. I'm
it,
sorry.
it's critically important that we address this now, because
Yes.
we know as we reopen schools, we're going to have students who have experienced trauma. We're
Yes.
going to have students who have been in situations that haven't been the most supportive. We have a lot
Right.
of students who feel safe and supported in our schools, and they haven't had the same access to us for the last
Right.
couple of months.
Right.
So
And we want to make sure that people have that.
yes.
So the overlap then, and you just touched on it already, the piece of trauma, but also um, are there what other topics might overlap with SEL? We talked about mental health and perhaps trauma. You kind of touched on equity. Is there more there that we should be exploring?
So we have a list. When we release the draft competencies in their second form, we're actually going to have an introduction that talks about some of the overlap.
Oh,
Um,
okay.
so for a lot of years, we had RTI and PBS. So
Mm-hmm.
response to intervention, which was more academic, PBS, positive behavior, interventions and supports, which was more about student behavior. We
Mm-hmm.
now have pulled that under multi-tiered system of supports
Okay.
in the state. So we see SEL as a critical component of tier one. That means universal practice. So we're going to be explicit about that. All kids
Sure.
should
All
have
kids.
explicit social emotional focus in their world, um, every day from every adult. It needs to be something we focus on. And when a student needs additional intervention, it should be tied to those same skills. There should be a clear connection. You're struggling with self-awareness. We're going to do, weekly counseling sessions, and we're going to focus on this skill. There's also an overlap, with other programs that are out there. But again, I'm not going to go through each of the names. But
Right.
we do want to be explicit that there's a tie with just school climate in general. And so that introductory document will have each of those.
Okay, good. So people can check that out and see the connection. I'm really excited about the work that you all are doing and the progress. And even given the current situation with everyone working remotely, you're getting a lot done, it sounds like, and you're getting a lot of support. So that's really good. So those people who are tuning in now, I know that Wes just shared a slide that had some links there that for people could get more information. Are there any questions from any of those of you who are tuning in right now that we haven't covered that you'd like to hear more about? And if not, are there ways that we could follow up and have more conversations in the future around this idea? Is anything else we need to talk about, LaWanda? Anything else you want to share?
No, other than I encourage people to use the bit.ly link to
Mm-hmm.
view the competencies. We have them divided in two different ways, presented in two different ways. You can either look just by competency, K to adult,
Right.
or you can look at the specific grade band, knowing some people really want to know, what should my 8-year-old be able to do at this point
Mm-hmm.
developmentally? But then we also have those who really just want to look at, so what does self-awareness mean, and how does it develop as
How does it
students
grow?
learn?
Sure. Sure.
Yes.
I love that. I love that. Well, I'm certainly going to be checking it out. Well, I want to thank you for joining us. I apologize for any of the technology challenges that we had at the beginning, but Wes has just made a little more information available for people in the comments link too. And I want to thank everybody for joining in. And LaWanda, it's always a pleasure to see your face and to
Thank
talk
you,
about
Annie.
important information and our shared passions. Have a great day, everybody. Thank you.
Thank you.